If I go through with it, I have death. If I don't go through with it, my choice is essentially to suffer and to inflict suffering on my family and my friends, and then die. Craig Ewart was 59. He was dying from amyotrophic lateral sclerosis, also referred to as ALS or Lou Gehrig's disease. That was his statement on his choice to use euthanasia as his way out. ALS is a harmful type of motor neuron disease. Motor neuron diseases are neurological disorders that affect neurons, which control voluntary actions such as walking, eating, and talking, etc. Euthanasia refers to the ending of a person's life assisted by a doctor. The word euthanasia is derived from the Greek words meaning good death. Voluntary euthanasia occurs when the patient decides for him or herself that he or she wants to die. There are two methods of voluntary euthanasia. One is passive euthanasia, and this occurs when the patient's medical treatment is terminated. The second method is called active euthanasia, and this takes place when the patient uses lethal drugs or an injection to kill him or herself. A terminally ill patient is someone who has a disease that will kill them. Examples of terminal diseases are motor neuron disease, ALS, which is another type, AIDS, and some types of cancers. Currently, euthanasia is legalized in Oregon, Washington, Texas, Switzerland, and Belgium. It is resolved that voluntary euthanasia should be legalized in the United States for the terminally ill. The first reason euthanasia is justified is because the Hippocratic Oath supports it. The Hippocratic Oath is an oath in which every doctor takes upon graduating from med school. There are two types of Hippocratic Oaths. First one is the classic, and the second one is the modern one. Today, medical schools now only use the modern text. In the classics version, it stated that it was against the use of lethal drugs in killing people. However, like I said before, this is not used today and is irrelevant to our debate. However, the classic one states exactly, but it may also be within my power to take a life. This awesome responsibility must be faced with great humbleness and the awareness of my own frailty. This means that a doctor can take a life, but only if the patient agrees, because the oath states that the doctor is there for the patient. We, the affirmative, believe that euthanasia should be legalized for the terminally ill as a way of ending their pain and suffering. First, euthanasia puts an end to the suffering of not only the patient, but the patient's family and friends. Everyone think about someone lying in a hospital bed, moaning and groaning. Ask yourselves, would you rather see them peacefully gone, or sit there every day, moaning and groaning because they're living a painful, miserable life? This is what some people have to go through every day. They go through torture, and this is why they should be able to die, if they want to. With the legalization of euthanasia, there will be a solution to both the terminally ill and their family and friends suffering. Another reason why euthanasia should be legalized is that people have the right to die, In the United States, citizens have the liberty to make their own decisions, so why cannot they have the choice to live or die? In the 14th Amendment, there's a clause called the Due Process Clause. This states that a person cannot be deprived of liberty. Without the legalization of euthanasia, a person is deprived of his or her liberty to choose if he wants to die or not. The right to vote includes the right to abstain. The right to free speech includes the right to be silent. And the right to live should include the right to die. It is your body, your life, your choice. This was said by Trevor Sathrin in his book, Pros and Cons, A Debater's Handbook. Along with the right to die is a patient's will to die with dignity. This means that a patient can die with a sense of self-worth and not die with a feeling of uselessness because of his or her inability to do anything. Some patients, when they are in a weak state of health, cannot perform the basic everyday functions such as eating, walking, seeing, talking, etc. This adds to the mental suffering of the patient. For example, Patrick Bethany was living with ALS and chose euthanasia as a way out for many reasons. First, he could not wash or dress without the help from his family. An Oregon article stated, Pat felt he would rather be dead than accept help to bathe and dress. Euthanasia, also referred to as mercy killing, should be legalized in the United States for the terminally ill. This will end the suffering and pain to patients all across the nation. Understand that a terminal disease can affect anyone and everyone in this room. I asked you to think how you would feel if, God forbid, you or loved one was put in this situation. Is the life of everyday pain and suffering worth it? Thank you. Vote affirmative.